The cervical brace is a device that was developed by Dr. Ron Delano, and Dr. Ron Delano used this device to help patients with a loss of cervical lordosis. Now, what ends up happening with a lot of patients with scoliosis is they have this loss of cervical lordosis also associated with it. So the cervical brace, or the cervical collar, I like to call it, and they call it cervical guard, is that it allows us to pull the head back and induce a cervical curve at the exact same time. So we reduce forehead posture, and we're helping improve also cervical lordosis. But providing both these things, we can really help patients with scoliosis, because a lot of patients, they have this as a result of the scoliosis. Most patients with scoliosis, they're having a loss of normal thoracic kyphosis, and this normal loss of thoracic kyphosis typically leads to a loss of cervical lordosis. Very often they'll wear this brace for up to 20 minutes. And a lot of times we'll associate this brace use with high tone vibration. They could be standing on a vibration plate to help have a stronger effect. Because the length of time they're in this, it can have a very strong stabilizing effect, but it also provides some mobility, because as we're pulling the person back into that correct position, it does create some stretching and elongation of certain tissues. But since it's a sustained motion, it's not as mobilizing as some of the other things that could actually be moving in and out and causing this repetition forces or repetitive forces. The sustained force does provide some stability associated with the procedures.